As Boris Johnson's government struggles to control the rising rate of coronavirus, the Labour leader, Sir Keir Starmer, says the time has come to impose a short lockdown of 2 to 3 weeks, what's being called a circuit breaker, throughout England. Sir Keir said the mix of measures imposed by the Prime Minister was not working and that another course was now urgently needed. Official documents reveal that government scientific advisers called for a short lockdown some 3 weeks ago, but their advice was rejected by ministers. And Labour's backing for a lockdown is now being seen as a significant change in the debate on tackling the pandemic, as our Deputy Political Editor Vicky Young explains.
Coronavirus cases on the rise, hospitals under pressure. Liverpool faces new restrictions from midnight.
We've got the spirits, scousers.
Households won't be allowed to mix, but shops, restaurants, schools and workplaces will stay open. The government's scientific advisers privately recommended 3 weeks ago that it was time to go much further. And today the Labour leader backed their plan for a national circuit breaker, a short period when all hospitality and leisure venues would shut. For months, Sir Keir Starmer's broadly supported the government's approach. That came to an end with this direct message for the Prime Minister.
You know that the scientific evidence backs this approach. You know that the restrictions you introduced won't be enough. You know that a circuit break is needed now to get this virus under control. You can't keep delaying this and come back to the House of Commons every few weeks with another plan that won't work.
He says the test and trace system isn't working effectively, and that's hampering the return to normality. You're now talking about a return to a blanket national approach. Isn't this going to be a huge cost to the economy? And isn't it better to have a tailored approach for every single region?
I think the damage to the economy will be caused by weeks and months of the approach the government has set out. This will break the circuit, bring the R rate down.
And here in Wales, where Labour is in charge, the administration's also putting pressure on the Prime Minister to discuss a UK-wide approach to tighter restrictions.
I asked the Prime Minister for an extra special COBRA meeting specifically to discuss the circuit breaker idea.
Some senior ministers did argue for this circuit breaker idea, a short, sharp lockdown over half-term to try to stop the virus spreading. But they were overruled amid concerns about heaping even more damage on an economy already battered. Ministers admit there are difficult months ahead and in the Commons defended the approach they're taking.
Governments of all different stripe, political persuasion have all come to broadly the same conclusion, which is it is necessary to restrict socialising because that way we reduce the transmission with the least damage to education and the economy.
It's not surprising that
but many Conservative MPs disagree, pointing to the economic damage the restrictions are already causing.
we have to get the country back to work. We simply cannot go on bailing out businesses. We are going bankrupt.
There is no silver bullet, and without one, although difficult, we must learn to live with the virus. The continued peaks and troughs are unsustainable.
The Prime Minister is being pulled in different directions, and there are serious repercussions to every decision he makes. And across the UK, politicians are really grappling with what to do next in a worsening situation. Tonight in Stormont, the Northern Ireland Executive having late-night talks to decide whether to bring their own version of a circuit breaker in. Here, Boris Johnson has decided to stick with a local, flexible approach. They think that different areas will need different things. And there are plenty of Conservative MPs very wary about the whole idea. They think 2 to 3 weeks of a lockdown could become far longer with all the consequences that entails. Boris Johnson is getting lots of advice, lots of ideas and suggestions. No one, of course, can be sure whether any of them will work.
Vicky, many thanks again. Vicky Young with the latest there at Westminster. And as Vicky was saying, we heard earlier, it was 3 weeks ago when the UK government's own medical and scientific advisers were calling for some kind of short lockdown in England. Documents released from a meeting of SAGE, that's the Scientific Advisory Group for Emergencies, said an immediate circuit breaker was the best way to control cases and to slow the spread of the virus. Our medical editor, Fergus Walsh, has more details.
The SAGE documents warned of catastrophic consequences unless rapid action was taken to bring the R number down. It's currently 1.2 to 1.5, which means every 10 infected people are passing the virus to between 12 and 15 others.
Strict measures we know will reduce the prevalence, and the danger of introducing measures that are not strict enough is they're still economically damaging and still damaging to personal freedoms, but the prevalence keeps rising.
The scientific advisors wanted a 2-week circuit breaker lockdown with an order for people to stay at home. They thought this would bring the R number below 1, but would have a short-term impact, perhaps reversing the epidemic by 28 days. One recommendation that has been introduced is that anyone who can should work from home. The scientists think this could reduce R by up to 0.4, and they believe the advice should remain in place indefinitely. SAGE also called for all university lectures and tuition to be moved online. They think that could reduce R by up to 0.5, but not if students remain in their term time accommodation. The scientists also wanted the closure of all pubs, restaurants, cafes, gyms, leisure centres and hairdressers. They say these would have a more modest impact on suppressing the epidemic. The SAGE committee warns that a circuit breaker would have negative impacts, especially on the poorest in society. Ministers will also be assessing the detailed economic consequences.
SAGE is advising them on the medical science, the epidemiology and the behavioural side of these things. They will also be taking into account economic questions. They'll be thinking about what the government and the country can afford, and they'll also be thinking about things from a political perspective.
Unless radical restrictions are imposed, SAGE warns there could be 3,000 hospital admissions a day in the UK by the end of the month, the same as the peak in early April. Their view is the action taken so far is simply not enough to rein in the virus. Fergus Walsh, BBC News.
Let's take the latest look then at the official figures released today, showing a rise again in new infections, 17,234 recorded in the latest 24-hour period. That's up from just under 14,000 recorded yesterday. It means the average number of new cases reported per day in the past week is 14,973. Hospital admissions have also increased. On average, 658 people were being admitted every day over the past week, and that number does not include Scotland. 143 deaths have been reported. That's people who've died within 28 days of a positive COVID-19 test. And it means on average in the past week, 82 deaths were announced every day. And just a final figure, which is that total number of deaths. So far, across the UK, it's now 43,018. Fergus is with me once again, Fergus Walsh, our medical editor. When we see those figures, and clearly some of them are startling, what should viewers make of them?
Well, it's the highest daily death toll, Hugh, since June. The trend is very much up, and I have to tell you, we are going to see further increases in COVID-related deaths in the coming weeks. In a sense, they're locked in because many of them will be people who got the virus 3 or 4 weeks ago, and we're seeing the epidemic doubling in size every 7 to 14 days. The only question is, how high will they go? Now, we're a long way from the 1,000 daily deaths we had in April. The average age of those dying from COVID is 82. The average age of those going into intensive care is 60. And the concern is that as hospitals start to fill up with COVID patients, it will begin to have an impact on non-COVID care, on operations, on diagnostics. Now, one thing in those SAGE documents that I want to point out is an absolutely damning critique of the government's test and trace system. It calls it having a marginal impact on reducing the spread of the virus, and says it will further decline unless it grows at the same rate as the epidemic.
OK, Fergus, many thanks again. Fergus there, our medical editor.